Hi everyone, it's Harp here. This week we've got Dr. Joanne Doran who's going to answer a question we've received about how and when to access palliative care when the time comes. So I will hand over to Dr. Joanne now. Thank you.
My question's from Anna. Thank you very much, Anna. And it's when and how should I go about accessing palliative care for my parents when the time comes? I've heard other people have problems getting access to beds in hospital in the palliative care unit. So this is such a great question because it brings up several things. If you're in a position and you're starting to think, I wonder if palliative care would be helpful, that's the time to talk to your healthcare provider. And palliative care is general palliative care, the palliative approach, which is approach to care when we know cure is not possible, and the aim is about quality of life and helping people live as well as possible for as long as possible. All health care providers will have capacity and capabilities in that arena. If, however, your needs are more complex, or your parents' needs are more complex, then you might need to see a specialist palliative care service. So you don't always necessarily need to see a specialist palliative care service. It's only if things are really troubling and the healthcare providers want to escalate your care. So when you see a specialist palliative care provider, you might just see them as a one-off. You might need ongoing involvement. You might need admission to hospital. But for the most part, most care is provided in the patient's home. So we really try and keep people out of hospital, in their home environment, which might be home, which might be a hostel, which might be a residential aged care facility. And it's really about making sure the right person's in the right place. Very few people need to go to the palliative care ward. It's only if they're needing specialist ongoing involvement because they've got some complex usual pain control issues or symptom control issues. So yes, we are as strapped as everyone else in the health service, but if you need to be in the ward, in the palliative care unit of any area that you're in, you will be prioritised. I hope that's helpful. Thank you. Great question.